dear students. I am Zhussubalina and I am a teacher at the Department of Modern Languages and Translation Studies. So let me present you a lecture on the discipline key concepts in translation studies. So the lecture is called Translating for the Healthcare Industry. So translating for the healthcare industry is a critical endeavor that ensures effective communication between medical professionals and patients across different linguistic backgrounds. So this field demands not only linguistic proficiency, but also a deep understanding of medical terminology, cultural nuances, and regulatory requirements. So in multilingual countries like Kazakhstan, where Kazakh and Russian are widely spoken, the role of medical translators become even more pivotal. This lecture explores the intricacies of medical translations, highlighting common challenges, strategies for effective translation, and providing detailed examples in Kazakh and Russian. So accurate medical translation is vital for several reasons. So first one is patient safety. So misinterpretation can lead to incorrect treatments or medication errors. So regulatory compliances is the second one. So the healthcare providers must adhere to local language laws and guidelines. So the next one is informed consent. Patients have the right to understand their medical conditions and treatment options. And the last one is public health communication. So effective dissemination of health information is crucial, especially during health crisis. So strategies for effective medical translation. So to overcome these challenges, translators can employ the following strategies. So number one is continuous education. So stay updated with medical advancements and terminology. So number two is utilize glossaries. Develop and refer to comprehensive term database. Number three, collaborate with experts. So consult healthcare professionals for clarity. And then cultural adaptation. So ensure translations are culturally appropriate. So, and the last one is quality assurance. Implement rigorous proofreading and editing processes. So let's examine specific examples to illustrate the nuances of medical translation between English, Kazakh, and Russian languages. So medical terminology that involves a lot of terms. And the example here is hypertension, which is translated in Kazakh and Russian as hypertonia. So let's take another examples in Kazakh and Russian. So the term hypertension is directly transliterated into both Russian and Kazakh as hypertonia. This reflects the widespread use of international Latin-based medical terms in these languages. However, it is crucial for terms in these languages. So, and translator needs to recognize when a term is universally accepted versus when a localized term is preferred. So another example is patient instruction. For example, take one tablet twice daily after meals. In Russian, the translation should sound принимайте одну таблетку 2 раза в день после еды. And in Kazakh, тамақтан кейін күніне 2 рет 1 таблеткадан қабылдаңыз. So while both translators convey the same instructions, so the word order differs due to syntactic structure inherent to each language. So in Kazakh, the phrase тамақтан кейін, after meal, precedes the frequency, aligning with the language's typical sentence construction. So cultural consideration in translation. The example, discuss your end-of-life care preferences with your physician. So in Russian, обсудите с вашим врачом предпочтения относительно паллиативного ухода. So in Kazakh, паллиативті көмек туралы қалауларыңызды дәрігеріңізбен талқылаңыз. So end-of-life discussions can be sensitive and may not be commonly addressed in some cultures. So translators must approach such topics with care, ensure that the language used is respectful and aligned with cultural norms. So medication names and dosages are also important. So for example, administer 5 milligrams of warfarin once daily in Russian should be translated as принимайте warfarin 5 миллиграмм один раз в день. Yani кезек варфаринды 5 миллиграммнан күнне bir рет қабылдаңыз. So dosage instructions must be translated with absolute precision. So in case of the suffix nan is used to indicate the quantity of 5 milligram, which is grammatical nuance that must be accurately rendered to prevent dosage errors. So another example was taken from medical device instructions. For example, ensure the catheter is inserted aseptically to prevent infection. So the translation in Russian should sound as убедитесь, что катетер введен стерильно для предотвращения инфекции. And in case of the translation should sound as infeksiyanın aldını alу үшін катетерді стерильді түрде енгізіңіз. So the term aseptically is crucial in this instruction. So while the Russian translation uses стерильно aseptически, the Kazakh translation opts for стерильді түрде. So aseptical түрде, demonstrating how adverbial phrases are constructed differently across languages. So, and let's go to the public health announcements. So, for example, vaccination is the most effective method to prevent measles. So, вакцинация – самый эффективный метод профилактики кори. The translation in Russian sounds. And in Kazakh, вакцинация қызылшаның алдын алудың ең тиімді әдісі. So translating for the healthcare industry is more than just a linguistic exercise. It's a matter of public safety, ethical responsibility, and cross-cultural communication, as we have seen through detailed examples in Kazakh and Russian. So accurate and context-sensitive translation is critical in many areas, especially healthcare. So medical documentation, including patient records, informed consent forms, and discharge summaries, must be translated with precision to avoid any legal or medical misunderstanding. So pharmaceutical or clinical trial translations involves not only technical terminology, but also regulatory language that must meet international standards. Doctor-patient communication requires translators to be both linguistically and emotionally aware, using culturally appropriate language that fosters trust and clarity. And public health campaigns, especially in multilingual countries like Kazakhstan, depend heavily on effective localization and clear translation to disseminate information about vaccination, pandemics, or preventive care. So, for example, translating a medical instructions like take on an empty stomach as, so in Russian sounds as принимать на пустой желудок is correct translation. So in Kazakh, аш қарынға қабылдаңыз. So the Kazakh incorrect variant еще бос болған кезде үшін. So this is awkward and could confuse patients. So let's talk about other incorrect translations, so especially about dosage of drug. So for example, take one tablet twice daily. So in Russian, the correct translation should sound as принимать по одной таблетке 2 раза в день. And in Kazakh, күніне 2 рет бір таблеткадан қабылдаңыз. So бір күнде 2 таблетка ішіңіз could be interpreted as taking both tablets at once. So such minor differences in working can lead to critical health errors. In addition, translators working in healthcare must also be aware of the emotional and psychological states of patients, so the cultural nuances around topics like mental health, terminal illnesses, or childbirth. So the legal requirements for confidentiality and data precision. So, in conclusion, medical translators must combine linguistic fluency, cultural sensitivity, technical medical knowledge, and ethical professionalism. So, their role is essential in ensuring equitable access to healthcare, providing patient safety, and fostering global health communication. So, as technology evolves, translators must continue updating their knowledge of medical terminology, digital tools. But human judgment and cultural competence will remain irreplaceable in this sensitive and life-impacting field. So I hope my lecture was informative and interesting for you. Thank you for your attention.